The ventilators, the prototypes of the ventilators have not gone to production stage yet. This is a very critical equipment in management of any disease, and particularly COVID-19. And therefore, we need to be very vigilant. We need to be very, very careful, because if you are not very careful, then the machine that is supposed to save life can itself kill. So we need to be careful about it. We are going through the processes. By the time we actually allow them to be used, they will also be WHO standards. On the issue of the PPEs and local manufacturing, you know, there are only two factors that really make a difference. The first one is money. If you have the money to buy them, that's one. And money is not always in supply, as you well know. But what I would like to do at this juncture is to appeal to the COVID-19 fund that was launched by the president. They have collected quite a bit of money, and I would urge them that now we start putting some money into actual PPEs. I know that they have been going the processes of tenders and so on, but this is an emergency, and I would like them to fast track their support so that we can get some PPEs. We have been very lucky because we have got private organizations that have supported the government, particularly I can mention Airtel and World Vision, that gave us support by way of presentation of locally manufactured PPEs. And that has been a great support. So hopefully the fund, as well as the government, will do so. The third item that I think is, the second item that's critical, is the issue of capacity. Capacity. And I can tell you that the organizations or companies that we have approved to make PPEs, and I can tell you that the PPEs, just to sidetrack a little bit and talk about the PPEs, that the PPEs that are being made locally were passed by KEBS themselves, and then again, Dr. Nandili, who is here, and her team went visiting the factories, retested the materials, just to make sure they are properly hydrophobic and they are good equipment.